शहर में गुजरे यादों के लम्हे.
Welcome to another brand new episode of Salaam Namaste Singapore Season 4. My name is Vinay Bharadwaj. I'm very happy to have in this segment Ms. Kalpalata. She's a psychotherapist, hypnotherapist and a mindfulness expert. Kalpa, welcome to Salaam Namaste Singapore.
Thank you, Vinay. It's a pleasure being here.
Likewise. Kalpa, like the way I was telling that you're a hypnotherapist, psychotherapist and a mindfulness expert, right? So what exactly do you do to us?
Okay, my work is all about helping people to relook, rewire and redefine themselves.
Wow, that sounds very interesting. And you know, today's topic that I wanted to discuss with you is something that I've been hearing all the time. The fad word called mindfulness. You know, I see online, I see people around, everyone's into mindfulness. I really wanted to understand and tell my viewers in terms of what exactly mindfulness is all about.
Sure, it is the buzzword, isn't it?
It's the buzzword.
Oh, yeah. Okay, very simply put, mindfulness is all about paying attention on purpose to what you think, to what you feel, and any sensations in the body at any given moment, precisely as and when it is going on.
Right. So mindfulness is not meditation.
Well, you could say it does come under meditation, and it sort of looks the same way too, because we are static, we are sitting or lying down, but it's a very, very different too in another sense, because it has a lot to do with activity, with brain activity, because you are actively looking, observing, and taking stock of what's going on in your brain, in your heart, and in your body.
Right.
Whereas meditation is all about decluttering your mind and focusing on a single flame or a thought,
Like
so it's very
more
different.
focus
Yes.
kind of a thing.
Yes.
Right. How does mindfulness actually help mental health? Does it have a correlation? Does it help in mental health?
Oh, it has a huge effect on mental health and also on self-care and self-enhancement as well. Because think of mental health. When you don't realize what you're doing, when you lose yourself in your thoughts or emotions for that matter, and you're far gone into that mental health issue before you even realize you need help.
Right.
So with mindfulness, you get to catch it very early on, and you can also you can sort of balance and bring your emotions to a baseline. And that's a lot of scientific evidence on how mindfulness actually does it in your brain. It rewires your brain. So
Right.
it's very, very helpful.
And for common people, there is meditation classes, there is yoga, there is gym, and we know that we go for counseling sessions and stuff. So if we have to take up mindfulness courses or classes rather, how does it work?
Okay, the best way to do it is not a random class here or there. There is an 8-week course that I conduct through Calm Wellness Center. And what happens is you go through 8 weeks, one session a week of mindfulness, and you slowly learn step by step. You build up on your mindful habits.
Right.
And that actually is evidence that it has a huge effect on the neuroplasticity of your brain, meaning it can basically rewire your brain. It brings down your stress response and increases your calm response as well.
Does it help increase productivity and creativity?
Oh, hugely, hugely. Because when you are more in your baseline, even if you get angry, it's not to say that you're going to become a yogi after 8 weeks, don't take me wrong. But what happens is even if you do get disturbed or frustrated or flustered, it's easier to get back to your baseline.
Right.
And when you do that more and more, your brain is at its highest productive state. So you get more creative, you get more, you're able to concentrate more, and you also develop a lot of compassion for your own self and for others.
So this will definitely help all the corporate people where we are juggling between 9 to 5 jobs, stress, anxiety. So this is a great one to actually take up.
It does wonders.
Right.
In fact, in a corporate environment, it teaches you to be compassionate to your own self, because we're all beating ourselves, right? It's a rat race, so to speak. So it helps you to be more understanding and compassionate in a team, to your own self, and to be very mindful of whatever you're doing at that point. So that is a huge plus.
Lovely. So now how can my viewers get in touch with you if they want to take up this mindfulness workshop?
Oh, you can reach out to Calm Wellness Center through Instagram, through my email, or you can just send a text to +65 8133 4495.
People in Singapore, I'm sure, can have physical sessions, but what about people outside?
Oh, we offer mindfulness courses. The 8-week course is offered online as well. And don't worry, there's no reduction in an effort or effect of the course itself. So it's the same whether you do it in person or online.
That's lovely. That's fantastic information, and I kind of learned what mindfulness is today, and I'm sure I would want to explore that side of me through taking this workshop to kind of see how is it going to rewire my brain. So thank you for educating us, and thank you for coming on the show.
My pleasure. Thank you so much.
What we learned today is about mindfulness. What does it mean? How does it help us? So basically what Kalpa told us is mindfulness is all about increasing productivity, increasing creativity, and helps us deal with stress and anxiety in a better way. So that was great information. Reach out to her if you need more information on mindfulness and all the workshops that she conducts. That's it in this segment. You don't go anywhere. You're watching Salaam Namaste Singapore Season 4. We're going to be right back. Welcome back. You're watching Salaam Namaste Singapore Season 4. I'm privileged to have two doctors in this segment. Thoracic surgeon Dr. Anis and cardiologist Dr. Devinder, who's going to be shedding some light about things that affect both lung and heart. Dr. Anis, Dr. Devinder, welcome to Salaam Namaste again.
Thank you.
Thank you.
Happy to have you both together. And this segment, I want to be talking about things that probably affects both heart and lungs. The first thing I want to address is chest pain. Chest pain, when we talk about chest pain, the first thing that comes to our mind is heart. You know, chest pain, heart pain. So what is the main reason for that, and what have you seen in the patients also?
So when you talk about chest pain, I think the most common thing that come in your mind is it related to my heart? Because that's most worrying actually. People are worried about heart attack. So yes, heart attack is one of the common cause of chest pain, which could be squeezing, discomfort, shortness of breath sometimes. But heart attack is not the only cause of pain arising from chest. There could be inflammation of the heart muscle. We call it myocarditis, which is quite now come up because of COVID vaccine. Because vaccine can sometimes cause inflammation of the heart muscles. That can lead to chest pain. Sometimes it could be due to something called pulmonary embolism, or a clot going inside the lungs causing chest pain or discomfort. I think Dr. Anis can shed more light on it. And rarely there are certain conditions which are very dangerous, like there is a condition called aortic dissection, where there is a tear in the major blood vessel called aorta. That can actually come as like a catastrophic event with chest pain as well.
There are many reasons
to have chest pain related to heart.
Yes. Right.
But heart attack is one of them.
Heart attack is one of them. And is there any reasons for chest pain because of lung?
There are many reasons for having chest pain apart from the heart. The most common, I would say, I'll be classified according to ages. In the young age group, commonest condition is called a pneumothorax, where there is air outside the lung but within inside your chest cavity, usually causes by a bubble in the lung which is burst and collapses your lung, and that causes pain.
Is that common?
It is. Relatively common. Adolescent, tall, thin, lanky teens is the classic description.
Right.
It can happen across any ages. It can happen even in the older people, and the pain is about the same, but they present more with shortness of breath than pain. There are other causes of non-cardiac pain which can happen. The most common, interestingly, is related to what is called reflux disease, which is actually a reflux of your abdominal contents into the chest, and they can present as a chest pain. So a reflux which is happening in the stomach can reflect as a chest pain, which is also a non-cardiac cause. There are a lot of rare conditions, things like having a neurogenic tumor, or as I've mentioned before, something like a fracture of your rib, which you may not be aware of, can cause persistent chest pain. There are even further rare causes, like you can have serious bout of drinking, and then you can have a rupture of the lower part of your esophagus, which can result in very serious pain in the lower part of your chest. So there's multiple causes to chest pain, so you can divide it, as they have said, between those arising or related to the heart and those which are not related to it.
And all treatable?
Most of them are treatable, yes.
Right. And it's either through surgery or non-surgery?
Yes. So interestingly, most of the thoracic surgical pain causes require some form of intervention. So like a pneumothorax is usually done as a keyhole surgery to resolve the leaking lung problem, and anything to do like a ruptured esophagus definitely is like an emergent surgical procedure to repair the hole in the gullet.
Right. And I think same with the heart-related chest pain, right?
So most of the problem can be addressed, and for heart attack, we can do immediate ballooning or stenting that can save life. And for myocarditis, where there's inflammation of the heart muscle, it depends on its severity. Sometimes patient may just be washed in normal ward and may not require anything except some painkillers, but sometimes it can be so severe, can lead to heart failure. In that scenario, the patient may even require intensive care monitoring, sometimes even life support equipment. But given good care, most of the time patient will recover.
What I take away from this is, if there is a chest pain, just seek medical help and don't do home remedies, don't Google.
Yes.
We'll figure out what it is it related to, heart or lungs, and get it treated.
Yes.
Another thing that is usually confusing is shortness of breath. Sometimes we don't know if it is related to the heart or related to the lungs. So in your respective areas, what's shortness of breath and why does it happen?
Shortness of breath is a very common symptom. Sometimes it could be just lack of fitness as well, and it is one of the common presentation to both cardiologist and thoracic surgeon, or in fact even to a GP as well. If you talk about cardiac causes, shortness of breath could be a presentation for even a heart attack or blockage in your heart arteries, that instead of presenting as chest discomfort may present as shortness of breath or uneasiness. Sometimes a weak heart, which could result from even previous heart problem, when heart is not pumping adequately, can lead to shortness of breath, tiredness, easy fatigability. Shortness of breath can also sometimes results from your right side of the heart getting affected because of lung causes, also causing shortness of breath. And sometimes, although we can say that it's either lung or heart causes, but they are so interlinked that it can be a combination of both.
Right. So it is one of the reasons for you to be very careful and seek medical help, basically.
Correct.
And does it, if at all you have shortness of breath one time, is it still alarming, or does it need to?
So it depends on how serious it is. So let's say if you run, if you're running 2 or 3 kilometers, and if you feel short of breath, that's not unusual because you are doing physical activity. But if you're feeling short of breath, talking which you never felt before, or if you can't sleep because of shortness of breath, or you feel like drowning when you lie down, these are very serious signs, and you should seek medical help immediately.
Right. And shortness of breath regards to lungs. So what are the things that you have seen in your career?
Mine is much more simpler than the heart. So the shortness of breath symptoms, although may be caused by the heart, the predominant organ which reflects it is the lungs. So I would say if you run after a girl for 3 kilometers and then say, you take my breath away, is different from sitting across a table and telling the girl, you take my breath away. So there are two different things. One epitomizes what effort your lung has taken to reach that status of tiredness, versus one which has never been stressed but gets tired often. Most common condition for a lung to present with that is called emphysema, which is usually related to smokers, where their lobes are destroyed, the elasticity is gone, and then they have what we call swollen lungs, which is basically non-functioning lungs which are overinflated, and they don't allow the good lung to function. So they present with shortness of breath. So, and also sometimes you can have shortness of breath by flooding of the lungs with water, which can be actually interrelated to the cardiac heart. So if there's a heart failure, the lungs can be flooded with water and the patient can present with shortness of breath.
Right.
The other condition which is also valid in present day COVID condition is that when a lung gets infected, it starts to weep. In a common man's term, it lets the water flow into the chest cavity. It accumulates as a fluid. We call it effusion technically. You can call it water inside the chest but outside the lung. So that also can present as shortness of breath.
Interesting.
So it can be many reasons
Many
across the
reasons.
board. Yes.
So whatever the reason is, seeking medical help and getting it checked early is very, very important. Thank you. That was very informative. To know about chest pain, to know about shortness of breath, I'm sure my viewers take a lot from this. Thank you, Dr. Anis, Dr. Devinder, to come on the show. And
Thank you very much.
Thank you very much.
pleasure having you. That's it in this segment. This was very informative to know what causes chest pain, what causes shortness of breath, and how heart and lungs both are extremely important in terms of these conditions. I'll be back again with another interesting segment. You don't go anywhere. You're watching Salaam Namaste Singapore Season 4. By the way, if you want to reach out to Dr. Devinder or Dr. Anis, below are their contact details. You don't go anywhere. I'll be right back. Welcome back. You're watching Salaam Namaste Singapore Season 4. In this segment, I'm going to show you one of those places where it is a one-stop shop for all your prayer items. I'm actually at Kunas. I'm going to take a look at the store. I'm going to see what they have and probably pick up something for my home and to give to my loved ones. Kunas is located very next to Varabhadra Kaliamma temple on the Serangoon Road. It is known for its one-stop solution for your prayer items. Kunas has amazing collection of variety of photographs, variety of idols, diyas, lamps, you name it for any of your prayer items, they have it. They also have some very interesting items like instruments and weapons of gods. So they have that if you want to pray for that at home. And again, because Hindu mythology has various gods and we have many festivals and occasions throughout the year. From your Dashera to Diwali to Sankranti to Pongal to Ugadi, anything that you name it across the clock, you would need some items for your prayers. Today I'm going to show you the variety that Kunas has in terms of its prayer and God items. So let's take a look at the shop. Let's take a look at what they have to offer to us. The aroma when you walk into the store is very nice. It's got that very calm, composed kind of an environment. So when you walk in, you already feel that you're walking into a very holy place. Being right next to the temple, it's got that aura and charm, I guess. So, and when I'm taking a stroll through the shop, I could see many interesting stuff. And my idea was, if I want to gift somebody for their housewarming, if I want to gift somebody who is, moved into a new place, have some great occasions at home, I think I can come here, just pick up idols, pick up deities, pick up decorative items. And also what is interesting is they have these huge brass lamps, which is very beautiful, very artistic. They have brass and bronze items that you can decorate at your home. They have beautiful lamps that you can keep in your living rooms or smaller ones for your altars. And they have very different variety and designs of altars, from wooden altars to multiple colors to sizes. And you can, reach out to them and probably ask them to customize based on how you want your altar to be. So if you're looking for something heritage, if you're looking for something which is very contemporary yet culturally inclined, I think Kunas is the place because they have really good stuff. So guys, Kunas is located right next to Varabhadra Kaliamma temple, very close to the MRT station, very close to the bus stop. So any of your needs, walk over here, you will find this place being your one-stop solution for prayer items. They also have amla juices. I saw some very nice healthy drinks that you can take in order to improvise your health. So I think what it tells me is, from your ghee to oil to camphor to lamps to agarbattis to everything. So any celebrations, birth of a baby, getting engaged, getting married, Gunas is your one-stop shop. So that's it in this segment. I'm going to be back again with a very interesting segment. You're watching Salaam Namaste Singapore Season 4. My name is Vinay Bharadwaj.